Naturally, we normally do these things in person, but equally this time, as a sign of the times, we're operating digitally. So today's session is going to be great. It's about digital transformation in the public sector during a pandemic. So obviously, very specifically looking at COVID-19 and what's happening. But equally, and actually, as we kind of conversed as this conversation started, actually how this will evolve beyond COVID-19. And I think it's a really interesting point, which is actually things are changing and will change forever in some guys. So the synopsis of this session is really looking at the adoption of digital technologies to enable public sector organisations to provide more efficient services in the public and the communities that they serve. So how can we better serve our communities through digital transformation? And in particular, with the challenges around COVID-19, why is this digital transformation been more important than ever? Because obviously we're all faced with lack of in-person contact and certainly no more than the public health services. I should have introduced myself at the start. By the way, I'm Johnny Fisher, one of the co-founders of IdeaDrop. I am only here to sort of facilitate and host, but I'm joined by three very kind and informative guests. So we have, and I'll let them introduce themselves separately, but we've got Adrian Quinn, we've got Ross O'Brien, and Ed Elliot. So I'll pass over to you just for a brief introduction before we get started. Adrian, do you want to just give a little bit of background of who you are and where you, it sounds like a dating show, who you are, where you come from.
Yeah, that's fine. Yeah, I'm Adrian Quinn. I'm working the Innovation Agency, which is the Academic Health Science Network for the Northwest Coast. The Academic Health Science Networks work to drive forward innovation and work with health and care and the academic sector and SMEs. Yeah, that's about it, really, I think.
Brilliant. Thanks, Adrian. And moving over to Ross.
Hi, I'm Ross O'Brien. I'm the Digital Innovation Director for Central and Northwest London Foundation Trust, and also the Programme Lead for the London Digital IAPT or Talking Therapies programme.
Fantastic. Thank you, Ross. And last but not least, Ed.
Hi, everyone. Ed, Head of Growth here at Public. Fantastic to be joining. For those of you who haven't come across Public, I guess in one line, we help tech startups work with the public sector, and indeed vice versa, help the public sector work with tech startups. We run a mixture of sort of accelerator programs, we do research, we also do a little bit of venturing as well.
Brilliant. Thank you very much, Ed. And again, welcome everyone, and thanks for joining. So today's format, I'm going to run through a number of different sort of topics and questions within those. These are things that we've sort of pulled together, but by all means, you will see the chat function. I'm sure we're all hopefully fairly familiar with WebEx or Zoom, or we're using WebEx today. You'll see on your right-hand side or at the bottom of your screen, you can put in questions. So if you put those questions in, we'll also try and fill them towards the end, but equally we can direct that conversation as we progress as well. So I'm going to kick off with the, and it's an open panel discussion, obviously with Ross, Ed and Adrian. But to kick off, we're going to talk a little bit about, so obviously we talked a moment ago about the digital transformation and the public sector and its obvious importance. I guess from your perspectives, I mean, why do you think that there's a need to adopt digital technologies and products and services and offerings? I mean, obviously traditionally the healthcare industry has probably not really sort of been in that space. Why do you think it's important that they move in that way, and how is that happening? And I'll open it up whoever wants to go first. Sorry, rather than pick.
Well, I'd say quite simply, it's there's an increasing demand on both health and care services. There's a need for things like enabling more self-care, promoting more independence, decreasing some dependencies, being more preventive, and digital's a key tool for this. We've seen it transform sectors like banking and travel, and health and care haven't been particularly quick to seize those opportunities because it's quite a complex system, and obviously there's some risk aversion. But people are increasingly expecting to be able to interact digitally with those services. So it's really just keeping up with people. with the public to be able to offer that.
Brilliant.
Ed?
Yeah, just to jump in and completely agree with Adrian, really. I mean, I think if you look at a kind of macro level, a really kind of broad view of what's happening across society and business in general, is that citizens who spend, half of their life in the private sector, whether it be through banking, through retail, through travel, have come to expect a level of sort of digital first, smartphone first service. And then they come to their local GP surgery, and it turns out actually, you have to go in to register, or depending on your particular GP surgery, go through quite complicated processes to have, your medication sent to your door, which is obviously a far cry from, what they might expect from Amazon or another part of the world. So there is definitely one part of it, an increased sort of citizen and user expectation. But I also think, part of it as well is that for most public services, health not is likely not an exception, that most public services are now facing increasing budgetary constraints, and being asked to do more with less. And it's really hard to see how that square is circled if not through innovation, new technology, and new processes. And if you add the kind of COVID layer on top of providing services in a different and new way, often remote way, I think more and more public services are looking at technology as a way to provide better services, but hopefully also cheaper services as well in a new and interesting way.
Also, from my perspective within the NHS, I co-authored a paper recently which was examining the response online compared to the response that we were seeing in the NHS in terms of referrals into services, and this was specifically around mental health services. What we were really surprised at, after canvassing input from about 50 different agencies, so we went to current digital therapeutics suppliers in Europe, in the States, in Asia, and we went to financial companies, and we went to social networks and peer support groups. And what we found was online, there was a huge shift and a huge spike for health-seeking behaviour. Whereas in the clinics and in the hospitals and in all of the healthcare facilities, we actually, in a lot of mental health services, saw a huge decrease in referrals. And so what that's telling us, or what we can surmise from it, is that actually people realise that if they need an instant and rapid response in terms of their health needs, where are they going to go? They're going to go online. What are they going to do? They're going to use digital tools, digital ways and means to seek answers for their questions. And quite to directly answer your question, we need to keep up with that, because where that gap emerges between what public does when they need help with their health and what the NHS and systems and government organisations do to provide support, that gap there is a risk. Quite literally, there's danger. There's people not getting treated, or there's other agencies that are working with profit more in mind than care. And we as a system need to appreciate that that's now, that's a common approach, that's a common kind of behaviour, that if people want an answer and it's about their health, they're not waiting for the first available appointment with their GP, which actually might be days or even weeks in advance, or if they've got a question around their mental health, they're not as prepared to wait as they were. So for me, it's just a necessity. It's just something that we absolutely have to respond to, and I think COVID in a way gives us that opportunity to do something positive and to respond in a positive way with all of the lessons we can learn from it.
Brilliant. No, I think, yeah, it's an interesting. I just say COVID's perhaps accelerated the things that are happening, and by virtue of necessity. And obviously, there's not necessarily a question. I think it comes on a little bit later, but obviously, the emergence of lots of private sector organisations within healthcare systems, which are probably disrupting and actually probably hopefully providing models and sort of trailblazing. But that's probably that's maybe me digressing, so I won't. But what's really interesting is obviously there's a clear and evident need for digitisation within public sector health and health in general. The big challenge, and as we all know, this is a very large question, so I'll allow you to refine it. But how is it actually happening? Because my understanding is as a consumer of health services is that organisationally, certainly the NHS isn't set up or hasn't traditionally been. I know there's great amounts of work happening in order to do that, but what steps are you seeing that are being taken in order to try and digitize some of these services and digital transformation? And any good examples of where you've seen this happen so far that you could share with the audience, that hopefully some things they might be able to take away?
Okay.
I think we're waiting for one another. Sorry, go for it.
Too polite.
I think it's very. I mean, I'm sort of in a support organisation, so what I've seen is it's quite diverse, really. You see instances where the digital technology comes first and it fails because they haven't actually looked at, what is the issue that they're trying to solve? What's the outcome they're trying to achieve? Or there's an attempt to sort of digitize an existing process, rather than thinking, well, do we actually need that process and can we look differently at it? So I think it's very variable, and I think sometimes where it fails is where there's a lack of engagement and the people who are, the professionals, the clinicians, the people who use the services, where they're not involved in that. I think there's something for me around failure. I think that's not always appreciated, and I think that's something that I think people need the space to do. You need the space to fail. We can be very risk averse, and obviously rightly so in some areas, because it's health and care, that's the area I'm in. But without the ability to fail, innovation happens at a slower pace, and failure shouldn't be penalised. It's you learn from it. So I've seen some really simple applications which have worked well because they've involved all the people who are going to benefit from it. One of the local authorities near me very basically introduced iPads and Wi-Fi and Skype for Business into all the care homes, and that simple thing, which seems sort of very straightforward, meant that the care homes were able to connect to multidisciplinary teams, amount of their residents going into hospital, reduce conveyances to A&E, and they're looking to build on that and introduce more telehealth, and then looking at a data hub to try and analyse all the data that comes out of that and look at that against other data layers. So it started off with just a way to try and kind of solve a problem of how do you get a GP remotely into a care home? How do you get another medical professional in? How do you stop people going to hospital when they don't need to? Involved all the people that it will impact on, and it's now developed into something bigger than it originally was. So that's a really simple example, I think, of where it can work.
Brilliant. Thanks, Adrian. No, I love that actually, and you're right. I think a lot of people, and we talk about it a lot, people talk about innovation being, assuming it needs to be large and complex and difficult and trailblazing, whereas actually taking existing technology and deploying it in a different way can have immediate and big and huge impact. So it's incremental change. That was a big change. For them, it was a big change, but it's led to other changes as they've become more comfortable with using that technology to do other things. So start with one thing and then, build on that. Build the culture. Brilliant. Ed or Ross, anything adding to that sure you've seen a few.
Ed?
Sure, thanks, Ross. Yeah, to jump in. I mean, I guess one of the difficulties of digital transformation is that I guess it can mean a lot of different things depending on the particular project in question, and that when embarking on, in a healthcare context, you come across a problem statement or a challenge, there's always a question of then how to tackle that challenge. Is it something that is actually a sort of something that needs a feature or a product approach, or actually is this a policy question? Or is this something that could be handled in an approach that doesn't necessarily need digital technology? All of those have to be sort of borne in mind. But then even once you have worked out, this particular problem you're facing is something that you think technology will be best placed to deliver on, there's then the question of, is it something that you should be building in-house? Is it something that, maybe an existing outsourcing relationship could provide? Or is it something actually that you think, setting up a new tender process or procurement process to bring in a new provider to provide, because you believe there's an existing product out there in the market that can plug and play pretty quickly, can deliver on, would be the best way to go. And that's often a complex decision chart that will be based on a lot of things that will be they're dependent on your particular circumstance. I think that from the work that I have done with particularly bodies in health is that you can often get sort of your approach to that sort of process clouded by the infrastructure you've already got in place, or delving too deeply in sort of technology solutions needing to be integrated with existing approaches. And then sometimes refining it to a simple process of, what is the challenge we're facing? How much information can I gain about my users, whether they be external citizens or internal, my staff, about how they're facing this challenge at the moment and what are the pain points? Going from there to find out, what is already being done out in the market, whether that be a product or whether that be my colleagues. And then sort of going from there to kind of go through the flow chart of what is the best potential solution available to me, or the best path to take. It often tends to be the best way. I mean, just from my point of view, Public has recently run a process with NHSX that has been sort of working through that sort of flow chart, particularly in the area of kind of remote care, care for the elderly who are based at home. We've now sort of test and trialed around sort of 20 different solutions across trusts across the country. And now we're hitting the next barrier, which is scaling. How do you, once you've got these solutions or you've got an answer to your problem, how do you scale it in a way that will then provide that sort of transformational value across your supply chain or across your business? So yes, I mean, that's my 2 cents, but I'd be really interested to hear from Ross's point of view from within the system, I guess, how you think about these things.
It's interesting. I think I was in a really helpful situation, and as much as my role was focusing on digital previous to COVID. So when COVID came along, all of the work that we'd been trying to do over the last 2 or 3 years happened within the space of 2 weeks, essentially. So things like we'd been pushing for clinicians to trial video conferencing, and had been told that the patients wouldn't do it, or the IG issues, or there were numerous reasons why we couldn't. And then all of a sudden we found ourselves within the space of 2 weeks having completely revolutionized our services and operating in a completely different way. Now, that has some positives and that has some negatives, but by virtue of this new world, I find myself presenting from my bedroom, you gentlemen, presenting from your kitchens. It's a weird and wonderful, great new world that we find ourselves in, and by no means difficult as well in terms of our new offices and balancing that with childcare or personal situation in terms of where you live. But stuff like that has shown us that actually the low-hanging fruit, and if you've thought about it before implementing those new approaches aren't too difficult. And I think there was something mentioned right at the beginning of this chat around that kind of low-hanging fruit, the bits that are easy just to adopt, rather than thinking of the most innovative, incredible digital new process. Actually, what stuff is out there already that's been out there for ages but hasn't had this environment, so could be adopted. And I think one of the things that we struggle with is that ability to talk to people en masse and say, these are our ideas, these are the developments that we think we should be adopting. What does everybody else think, or has anybody else got a good idea in terms of what should be adopted? So yeah, for us, it's been brilliant in terms of this has shown the art of the possible, shown that we can work in a completely different way. But I think our approach in coming weeks, months, and probably years, to be honest, is also, as well as thinking about structurally, what do we do? How do we not just take all of the issues that we currently have in the system and digitize those? But equally, what's the stuff that's already out there? What's the stuff that can make big impact and is going to be disruptive in a positive way, but the least disruptive for services, so that it can be stood up rapidly and used.
Thanks, Ross. And just got a quick follow-up question. Something Adrian mentioned, and actually it cuts across one of your points. Adrian obviously talked about the fear of failure, or actually giving permission to fail, which in public sector, or not public sector, healthcare in this instance, depending on the circumstance you're in, obviously you don't want a surgeon trying brand new things just because it's nice and innovative, and obviously not going the right way. That would probably have fairly catastrophic headlines. But on that point, and Ross, you mentioned obviously when COVID struck, all of a sudden the pace at which you were able to deploy things exploded, primarily because you don't really have a choice. Just following that trend or thread a little bit further, do you think as that helps make it safer in a way? Do you think that did people feel that actually by deploying these things quickly and they would have bypassed, or not necessarily bypassed, but they would have went through probably reduced risk profiles, or those decisions needed to be made? So it wasn't very often you see the old, oh well, there's this problem, there's that problem, and let us think about this, and we'll spend 6-9 months debating it, and there's always, because there's a due diligence process, that's obviously accelerated. Do you think that's safer now? Do you think are people feeling actually if they make these decisions quicker, they can go, we kind of had to do it, we have to act quickly? Or is there still a bit of a, do want to make that decision? Or
can I answer this one? I've got a really good use case for it. The Zoom debate. Yeah. I think it crystallizes that question. So basically you've got this huge shift that needs to happen overnight, and it does happen literally overnight. Services from sexual health to learning disability to nursing to whatever have shifted really, really rapidly. But you still have this weird retrofitting of information governance and cybersecurity into something that happened back then, and it's quite where we're going through quite strange times at the moment, where a lot of the decisions where we just had the decks cleared, make a decision, use a video platform, kind of get on with it, as long as you've done an impact assessment locally. It doesn't have to be what you would normally go through. Then kind of within weeks we're retrofitting in the NHS anyway. Those decisions that have been made into a much longer decision-making process. So it's quite an odd situation to be in, and I think the one thing that the NHS doesn't do so well is it thinks of clinical safety above and beyond everything, and sometimes to the exception of the patient's voice. And I think clinical safety obviously is very, very, very important, But when we're talking about digital advances, when we're talking about video conferencing platforms and how we actually communicate with people, we need to go back to basics and also think, how do people want to communicate, and in what fashion? So yeah, I think there was a period of grace, and I think we're starting to retrofit business as usual into a non-business as usual period, and there's obviously a risk with that.
Brilliant. That's very interesting. And just on that strand, an open-based question: the digitization of the consumer or patients in this instance, where does that sort of fit in? Because for me, that's a great thing, but it's also potentially looking at it from a advice at the healthcare provider side, a terribly scary thing, because I guess the healthcare as organizations aren't necessarily set up to have that very fast, direct interconnection digitally. And does that actually pose, well, I'm sure it does, what challenges does it pose? So all of a sudden you start, and I'm thinking quite specific, I'm thinking about, you start to interact with patients digitally and you say, okay, here we are, this is what we do, and we want to know what you think and how you. I know that will happen already in pockets, but have you seen where that started to happen and potential pitfalls that could occur or have occurred? So actually, it's opening the floodgates, I guess, is what I'm trying to say. Sometimes it's a big shift for an organisation.
I don't know. I mean, looking at it from something like GP services, they've done this massive transformational shift in the same way, to going from sort of 90% face-to-face consultations to 90% kind of online, virtual. But what's been reported is that those online systems have been more reliable and resilient than expected. They've allowed them to cope with, things like self-isolating doctors, self-isolating patients, temporary loss of practice premises. It's meant that their accessibility is greater, waiting times down from 3 weeks to 30 minutes in some cases. And it's also, if they have reorganized themselves effectively enough in terms of their resources, given them more time to be more proactive about maybe looking after more needy patients in a more, not waiting for them to come to them, but doing regular blood pressure checks, and rather than just being reactive. So there is a need to, I suppose, with any digital tool that you use, to look at, well, what does that mean for how we provide our service, and how can we make sure that any capacity that's freed up, because of course the other thing about digital is it allows you to deal with and support more people. And we do have an aging population. We do have a lot of people who will need more support. So if it can free up capacity anywhere, it's important that we try and use it, but that we make sure that we are organised in terms of the way systems are organised to deal with that increased pace, I suppose. In the how well organised they are to work with these tools at the moment.
Yeah, just to jump in on the back of that, because I think that's very true. Just to jump in on in particular, the kind of personal data point, which I think, Johnny, you alluded to, that it's very hard, if not impossible, to imagine a form of healthcare delivery that is personalised to the individual, to the particular drugs they're using, to the particular circumstances of their care, which is ultimately where we want to head to as a healthcare system in the macro. It's very hard to imagine that without having much greater access and sharing of personal data across health services. However, obviously, as we all know, that comes with the potential of, if used incorrectly, potential cyber threats, giving individuals who shouldn't have access to that data, that there is always that possibility. What we should be aware of is that there are lots of important parts of our lives, banking, for example, where this is being done pretty much all day, every day. And yes, there are abuses of that system, but you know, this isn't something that is a completely new jump for parts of our life. That, you know, our personal data is there on the internet in lots of different ways, and whether we like it or not, it has been used by lots of companies. Is purely the case that, you know, us as a healthcare service and public services more generally have to be smarter about how we're using that data, but also make sure that we've got the relative information governance and that our suppliers do to be able to manage that. I think just going back to Ross's point, I think what's really interesting about the process, the period of COVID, is that all of this transformation, and it is huge amounts of transformation, I mean, across health, but also if you look at, say, policing, there's been more digital transformation in the last 2-3 months than there has been in the last 5 to 10 years, arguably. And the main reason for that is that it is at the moment more dangerous for health services to stand still than to do something. And that for quite a long period of time, whether for better or for worse, public services have erred quite a lot on that it has been safer to stand still. And I think we're starting to hit a point, if we've not hit it already, where actually innovation and transformation is now so integral, you know, regardless of COVID, to providing good services that can save lives, that we actually have to now start thinking, actually, no, there are lots of other cases completely un-COVID related where it is better and safer and better value for money for us to start thinking about transformation than it is to stand still and avoid it and pass it down the line to next year or the year after.
Just to add to that as well, I'd say sorry. I was going to say, just to add to that, I'd say that what I've seen is this collective collaboration and focus, and lots of people in the health and care system all moving forward at the same time, actually helping each other out and making that massive shift together. And not that there wasn't collaboration before, but I've just seen it on a much more intense scale. And I think there's a collective will now to harness that and make sure that we learn from, you know, what we've managed to do in such a short space of time and apply it to other areas and work together as well.
Yeah, agree wholeheartedly.
Yeah, it's a really interesting, well, lots of interesting points. And in particular, just one strand, just picking a little bit on more just a summary point. I think you said, which is the reality is that there will be mistakes that are made, but actually there are mistakes that are made every day, but they're acceptable mistakes because they're tolerance levels that are built into the system. But where you take something that's new and go, is there a risk? There is always a risk, but those risks or tolerances haven't been explored. So there's a bit of bravery, and goes back to Adrian's point at the start, which is accepting a little bit of failure, which everything won't be perfect, but accepting that there has to be tolerances and as difficult as that is, risk built into the system to go, we will have issues and there will be, unfortunately, areas of exploitation, but we just need to be able to manage it. But it shouldn't be a reason not to do anything, because otherwise we would never progress. And it might be more linked, well, no, actually, it's probably quite open, but certainly, Ross, from within your unique view within an actual trust, we talk about how it affects everyone else, but sometimes we ignore the poor people on the front line, and many of which are also experiencing great amounts of digital transformation and are having to adapt. And is there much of a sense coming from those people as to how they find it? So it's easy for us to go, yeah, digital transformation was easy for me, basically, so I have to do it, but how it's being impacted and different services and how they deliver those services and different risk profiles that they have to carry out. But they're the ones that actually have to do it. Are they actually comfortable, or are they kind of going, I know this is what everyone wants, but actually we deliver it?
Who wants to go first on that one? Shall I go?
Yeah,
go for it. Sorry.
Nice try there, Ross. I like that.
So it's a good question. The feedback that we generally get is that there is, and try to be platform agnostic, but Zoom fatigue. Lots of therapists are finding themselves in this new world of being outside of their normal comfort boundaries, and taking mental health talking therapists as an example. So normally a therapeutic boundary, people operate from in a clinical space. They would probably see the client in one specific room on a regular, like maybe a weekly basis or something like that. And then all of a sudden, you're inviting clients into your own personal space, which is quite a big shift and is uncomfortable. Also, you're operating through this medium where I'm sure everyone can relate to this as well, where it's a different kind of intensity, where I think some of the studies that we've done previous to COVID with the average time period for somebody to get used to operating on a day-to-day basis via video was up to 12 weeks. So just by virtue of the fact that you can see yourself in the corner of the screen, and navigating the ability to use video as a platform as well is certainly difficult. So I think there's that's one of the principal things that we get fed back, is that it's digital now. This is how we're going to communicate, and this is how we're going to work. I think also the other thing we've been in our trust, we've been keen to mimic some of the really good work that's been done in other good trusts around putting devices into the hands of patients on COVID wards in order that they can maintain contact with their friends and family at home. And I think it's a really honourable, I think it's a really, really lovely piece of work to do in terms of maintaining that contact for people that cannot go on to the wards and cannot see their loved ones. But some of the feedback that I get around the people that are taking the lead on those projects are that literally when they walk up to the nurse or the member of support staff that's going to facilitate that and go to hand them a tablet device, they literally almost wince, because for them it's the responsibility of the tech and the hardware. It's navigating an iOS that they don't know. It's infection control. It's will this device be used as a weapon against me? There's lots of potential for worry and danger around it. So there's lots of different angles. So it's not perfect, but I'll stop there.
Thanks, Ross. Adrian, Ed, want to jump in?
I mean, I suppose I have a slightly different perspective, because I'm not as close to the front line, because I don't represent a particular trust or organisation. We're more of a support service for the whole of the Northwest Coast. But what I have seen is that in terms of our support for the integrated care system in Lancashire and South Cumbria, and also the Health and Care Partnership in Cheshire and Merseyside, the meetings between all the people working in those areas are more inclusive and more effective now. That removal of travel, the people who previously may not have made meetings or may not have spoken are using the chat function in Microsoft Teams, and getting real-time feedback in meetings, and meetings are a lot more focused. So I think in terms of the world I've inhabited in terms of public service, everything seems to be getting a lot more slicker. The only slight problem is there aren't any gaps, because you can be everywhere. Previously, geography would have dictated that I wouldn't be able to get from Lancaster to Macclesfield in half an hour, so I'd have to miss a meeting. Whereas now that doesn't happen. Everybody is at everything, which kind of brings some of its own problems. But I'm just sensing a greater, more flexible and an enhanced ability to collaborate, which I think can only be a good thing with all the people who are trying to bring health and care closer together in terms of integration in the areas that I work in.
Fantastic, thanks, Adrian. And just before we go to Ed, actually, that's a really interesting point, and Ross touched upon it. The fact that, as you say, you can't get from one place to the other. Obviously, you're instantly And that's quite, it links back to we talk about frontline staff, but actually we're all working in an organisation. You mentioned obviously you can now make those meetings, but how does it affect you as well? It's all of a sudden when you had 30 minutes or 40 minutes or reflection time, we're kind of moving into this. Actually, it's just call. It's very difficult.
I don't mind it. I prefer the fact that I feel more connected, and actually it's become more the norm that somebody will message you or do a video call on Microsoft Teams and you have that immediacy. And actually I feel a lot more connected in with people rather than having to set up a meeting, or if I don't know, there is something about this way of working, which yes, there is a risk that you kind of, you burn yourself out a little bit because it's relentless. You just have to build in some gaps. But the payoff for that is that actually you're able to get things done a lot quicker. It feels so. I think that's good.
Yeah, well, that's good
from my perspective, anyway.
Yeah, no, I think you're right. It's building in gaps. I think that's where I go wrong. You kind of see a few spaces, you go, oh, brilliant, and then before you know it, someone stuck something. I think, really, that was my cup of tea moment. That was, but no, I think you're right. It's better planning. I'm sorry, Ed. I cut across. We were going to talk a little bit. I probably even forgot my own question, but I think it was talking about sort of the staff within these organisations and how they're dealing with all the change as well, not just the members of the public.
Yeah, I mean, I'm probably spend less time with frontline staff than Ross and Adrian, so I'm a little bit less, I guess, qualified to comment. But I guess my reflection on the question would be sort of taken in two ways. I think one is that my advice would be to anyone who is, procuring technology, particularly looking to procure technology from innovative startups or small companies, that this should be one of the first questions that you ask in terms of how do you actually deploy your technology in a workplace setting? What are your requirements? Do you have any evidence of where this has been deployed in the past and where you've worked with nurses or clinicians to actually make sure that it's being used on a day-to-day basis? Good technology companies will have thought about that. In fact, many of them these days are actually being built by former doctors and nurses to solve problems they faced on a day-to-day basis. So, hopefully these are things that should be really ingrained into how they develop their product. I think the second point is where I'm starting to see, or when you look at the sort of technology market, where you start to see technology heading, is that it is increasingly taking the need for training off the hands of frontline users more and more. And I think a prime example is natural language processing, which, for many of you who don't know what that means, and it sounds very complicated, it is very complicated in the back end. But what in effect it can do is, rather than having a doctor sort of sit down and write out all of the things that they've done in the day to sort of make sure that the bureaucracy of ticking boxes is done. Instead, they can talk into a phone, have that translated into doctor's notes, which ultimately saves them time and money at the end of the day, but doesn't require any onboarding or additional skill to do it. And I think if you look at the way in which particularly technology that's being provided for public services, they're more and more heading down that angle of trying to be as skill-free when it comes to deployment as possible.
Fantastic. Thanks, Ed. And we've got one more question that I just wanted to cover, and we could do it quite quickly. And then we've got a few questions that have come in on the chat, which we'll put to you as we move towards the end of the session. I guess I would love to ask, obviously, Ed, Adrian, and Ross, just what are you most excited about? So what future technology are you most excited about that will help drive digital transformation within the sort of public health services? So anything that you're aware of or have seen, and it may be a long way off, but it's just to kind of giving the audience a bit of a flavour for maybe some of the exciting things that are happening. And I should probably be doing my job better as a host. I can start with Ed, and then we'll go to Adrian and Ross. I know how to drop off, but for batteries, but I think there's rejoined, so we'll tackle Ross last.
Brilliant. Yeah, I think for me actually, I don't know if this is necessarily a technology point, but piece of work we've started doing is with around patient records, and I'm sure many who are on this call who are from the health services are well trained as to kind of EHR and everything that comes along with it. The real point at which kind of innovation and health services will be kind of set free to pursue a lot more in a lot more integrated way is the point at which healthcare records become more interoperable with one another, with other parts of the system, whether it be mental health provision, social care provision, and so on. And I think we're starting to see that happen. I think EMIS and TTP, none of their employees are on this call, but for a long time have been to some degree a blocker of that process. And I think what we're starting to see, and the company we're working with very closely, is starting to see that process being opened more and more and more for companies to have access to data, to create new services, to make sure they're linked into healthcare records, to the point where we can create a much more personalized and sort of 365 picture of what's going on around patients. So once they come into the hospital, doctors already have a really clear view of what they've been doing up until that point of time, the other healthcare services that they visited that may not just be, you know, their own GP surgery, but the other mental health clinics they've been to, their social care provision. That for me is the sort of starting point for where real innovation in healthcare will begin. And I think we can start to see it happening over the next sort of 2 to 3 years.
Perfect. Thanks, Ed. And Adrian?
I would follow on from that, actually, saying that once you have that, the ability for the individual to contribute towards that shared record with data that's generated from themselves in terms of their own insights into their health and well-being, but also the kind of the constant refinement of technology-enabled care and sensor technology and the ubiquitous nature of it, I think, will be quite transformational in terms of the connected devices that we have in our homes, in terms of the constant refinement of sensors in mobile phones, in headphones, in other wearables, and the ability for that information to become increasingly accurate and measure more and more of our physical vital signs, and to be able to upload that information as part of your health record. Then that gives you the opportunity then to start to kind of merge that with multiple data layers and gain some insights that can come back to you as an individual to help you manage your own health and enable more preventive approaches, because these things are happening. You know, Apple, Google, Amazon, all greatly interested in your health and well-being and using their devices and their platforms to help. So just the ability to leverage some of that, the things that people already have in their homes, I think that will be transformational. I'd have a shout out as well for things like 5G, because that kind of always on connected kind of low latency thing can enable a lot of very exciting things. The sharing of data, again, comes back to putting the person at the center of their data, them being the data controller. It might be held in different areas, but if you're able to give consent, informed consent at different levels, you know, you might want to share it immediately with your people involved in your health and care. You might want to share it for research, but you're in control of that. And the people that hold your data are just the custodians of it. And if that's dynamic and done via an app or something that's very easy to use, that can open up lots of possibilities. So I think, yeah, sensors and data, I would say.
Brilliant. Thanks, Adrian. And I think Ross has been able to join again. Thanks, Ross. I'm not sure if you caught the question, but it was just a sort of an overview of what you're most excited about, or what future technologies you're most excited about that sort of drive digital transformation.
Are you able to hear me, just to double check?
Yes, yeah, we can hear you loud and clear.
Excellent. Okay, sorry, apologies. This is one of the examples of COVID being a brave new world. I've not got a charger for my laptop and it's run out of battery, so I've joined you on my phone. So one of the areas that I'm really, really passionate about and have been working on for a couple of years and would really like to see expanded is the use of virtual reality in healthcare. I think there's an option now where more people are staying at home, less people are traveling, and a lot of healthcare facilities have actually been closed because of the risk of still remaining open during COVID, presents an opportunity for the application of virtual reality. So, say for example, one of the projects I've been working on recently is with a GP based in Cumbria, who has a virtual reality program for pulmonary rehab. So in the immediate days after the lockdown, the pulmonary rehab services, so the respiratory rehab services up and down the land, closed because that cohort of patients were even more at risk from COVID, because it's to do with respiratory systems. And for me, that's a kind of like a double impact for the patients. And what was really interesting was this GP's approach in terms of using virtual reality was to prescribe a headset, to send it out to a patient, and for them to have the ability to go through the rehabilitation program in the comfort of their own home. But not only that, the virtual reality headset itself picks up a lot of the biometrics that you would expect through that direct clinician to patient relationship. So things like being able to know how often somebody tries out the exercises, knowing to what degree they're able to fulfill the exercise, how much capacity they've got in their lungs, or where their heart rate is, or all of that sort of stuff can come back via the headset. And it's I think there's lots. That's just one example. There's a lot of work in the reduction of pain and distraction from pain using VR. There's a rich body of evidence spanning back to the 80s around using virtual reality to treat post-traumatic stress disorder, and a range of other phobias and mental health issues as well. I think this presents both a challenge in terms of infection control for virtual reality headsets and how to get round that, but also the opportunity of, as we all find ourselves quite oddly a little bit more isolated and remote, is the opportunity with VR to reconnect us digitally, and again, like we've mentioned earlier, to actually work at scale as well. So one clinician to treat many people concurrently via kind of monitoring their vital signs and touching in and finding out how they're doing in terms of the clinical process that they're going through, but just at scale. So that's the one that I'm kind of keeping my eye on and hoping we can expand on in the near future as well.
Thanks, Ross. And no, it sounds pretty transformational for where we are, and a huge leap. It'd be quite, well, exciting is maybe the wrong word. I'm sure people aren't looking forward to it. It means they obviously have medical issues or challenges, but yeah, I think being able to solve those in a more digitally innovative way will be moving much for the times. I think we've got time for one last question. We've got a few questions come in, but I'll pick the one that we have from Ballas, and apologies if I'm saying your name incorrectly, but it's off the back of Ross's comment, but an open question. So when you were talking about the tricky art of balancing clinical safety and patient voice, what could we at the NHS do better, either systematically or at a provider level, to survey and demonstrate patient demands and preferences for digital solutions? So I guess to summarise, looking at how we balance clinical safety with patient voice, and how do we speak to the patients and understand if they want these services in these ways. It's quite an interesting dynamic.
Should I take that one first?
Yeah, please. Yeah.
I think one of the things that's been difficult about involving patients in the past has been trying to find a time to allow the patients to join meetings and panels and design sessions. Also, it's not just the meeting itself, it's the travel time around it, it's the engaging in networks. And where we find ourselves at the moment is in a position where everyone has moved online for every aspect of their life, whether it be shopping, socializing, work, or whatever else. And so actually gaining access to people who want to talk and who want to input into the design of services on a digital platform is actually a hell of a lot easier than it was 3 months ago. And I think that's the mindset that we need to approach patient engagement versus clinical safety. I think we need to very much expect that people will want to have an input into new services, especially ones that that have matured in other spaces, like was mentioned earlier in terms of banking, finance, that kind of area, and health is playing catch up. I think creating the space where people can input online to the future development of services is the perfect time to do it.
Thanks, Ross. And got a few minutes left. Ed, do you want to give us a quick view on that as well? And then we'll finish with you.
Yeah, sure. I guess it depends a little bit on kind of what level of convincing in which individuals the evidence you're trying to find might be. I mean, I think hopefully at a kind of system-wide level, there has been lots and lots of research across lots of different think tanks, research organizations for health that has pinpointed kind of at a high level why there is a need for digital transformation in terms of the way we support patients. So there is a lot of evidence out there already, and I'll see if I can sort of dig some out after the meeting and after the call that might be able to be sent around. In terms of say a specific use case, say I don't know, there was a need, you wanted to sort of practice, find a way to build evidence to triage non-emergency calls to a GP practice, for example. There are lots of tools out there to help you that can go from the sophisticated to the unsophisticated. Obviously, survey data is a good way to go. There are lots of tools that you can find from surveying different groups of population to social media, monitoring to get sort of sentiment analysis from your users and what their own kind of reflections on your service has been. So there are lots of different approaches, and but probably the best place to start is if you're looking to make the case as to why sort of more generally greater focus on sort of patient demands and what they're looking through from health services. Google might be a good place to start and see what evidence is out there, and then sort of use that as a starting point to sort of test and trial, and hopefully sort of find some space for innovation with your senior management to get even more specific data as to the particular use case that you're looking at.
Thanks, Ed, and briefly, Adrian, any final thoughts?
Yeah, just to echo, I totally agree with what's been said. I think the key thing is you need to keep the person at the center of any digital solution, and actually digital can make that a lot easier to do because it's easier to actually engage with people. But for me also, there is this issue around you mustn't forget that digital exclusion still remains an issue. So it's important that any capacity that's created by using digital solutions, I think, is used to try and ensure there's an alternative for people that don't want to engage digitally. And for people that do, but can't or are unable, in terms of engaging them, it's about finding what matters to them. Waving a tablet at somebody saying you can check you can look after your health with this isn't always going to cut it, but actually it might be just finding the thing that matters to them, that uses that device to do something that they get comfortable with it, and then that can open the door to other things. So yeah, I think digital offers opportunities for engagement, but also mustn't forget that there are people that won't engage in that way.
Brilliant. Thanks, Adrian, and thanks everyone. That brings us to the top of the hour. I'm sorry, running a little bit late. big thank you to Adrian, Ed, and Ross for joining today and giving their unique perspectives on all those different topics. I hope the audience enjoyed it. Obviously, as mentioned, we'll be following up post these sessions with any materials. And Ed, thank you very much for your kind offer of anything you have. And equally, Adrian and Ross, if there are relevant studies or interesting articles you think you want to share post this, forward them on to myself or Nilla, and we'll add those to the packs. But thank you, everyone. Thank you again for our attendees, as well as our very informative panel. And